Hello and welcome. Today we're talking about a condition that's affecting more and more people, but often goes unnoticed until it becomes serious. We're talking about diabetes. Now, most people think diabetes just starts all of a sudden, but the truth is, our bodies usually give us early warning signs. Small things we feel or notice, but often ignore. In this video, we'll walk through the 10 early signs of diabetes. These are symptoms that can appear months or even years before a diagnosis. We'll explain each one in a way that's simple, clear, and easy to understand, just like a trusted family doctor would. Please stay with us until the very end, because we'll also share a bonus symptom that many people overlook, but could be one of the clear signs your blood sugar is not well controlled. And remember, this video is for education only. If you feel any of these symptoms, please consult your doctor for proper testing and advice. All the clinical studies are linked in the description below. Let's begin. Number 1. Frequent urination at night. One of the first and most common signs of diabetes is frequent urination, especially during the night. In medical terms, this is called nocturia. Now, why does this happen? When your blood sugar is high, your kidneys work harder to filter and remove the excess sugar from your bloodstream. But sugar doesn't come out alone. It pulls water with it. So your body makes more urine to get rid of the extra glucose. This leads to more frequent trips to the bathroom. For most healthy people, waking up once a night to urinate is normal. But if you notice you're waking up 2, 3, or more times every night, and you're not drinking too much water before bed, that could be a red flag. Over time, this can also lead to dehydration, because your body is losing water faster than it can replace it. That's why you might also feel thirsty all the time, which is another early symptom we'll discuss in a moment. Some people think frequent trips to the bathroom is just part of aging. And while that can be true, if it starts suddenly or comes with other signs like fatigue, weight loss, or dry mouth, it's time to get your blood sugar checked. In fact, studies show that nocturia is often one of the earliest signs of type 2 diabetes, especially in people over 40. So if you find yourself waking up multiple times a night to pee, even if you didn't drink much water, don't ignore it. It could be your body's early way of telling you something's wrong. Number 2. Unusual thirst. Another very early warning sign of diabetes is excessive thirst, or what doctors call polydipsia. This isn't just feeling thirsty after eating salty food or working out. This is a persistent, unquenchable thirst, even after drinking plenty of water. Why does this happen? When blood sugar levels rise too high, the body tries to get rid of the extra sugar by urinating more, as we just learned. But the more we urinate, the more fluids we lose, and this causes dehydration. In response, the brain signals us to drink more water to replace the lost fluids. So it becomes a cycle. High sugar, more urination, more thirst, more drinking, more urination. Some people notice that they start carrying a water bottle everywhere or that their mouth feels dry all the time. And it's not just during the day. Nighttime thirst can also be a clue that something is wrong. It's important not to ignore this kind of thirst, especially if it's new or unexplained, and if it comes with other symptoms like frequent urination or fatigue. In many cases, excessive thirst and urination appear months or even years before a diabetes diagnosis, so noticing it early can make a big difference in preventing complications. Number 3. Weight loss. This next sign surprises many people because we usually associate diabetes with weight gain. But in the early stages, especially with type 1 diabetes or uncontrolled type 2, we may actually lose weight without trying. Here's how it works. When there isn't enough insulin, or when the insulin in our body isn't working properly, Glucose, sugar, can't get into our cells to be used as energy. So even if we're eating plenty of food, our body can't absorb the fuel it needs. To make up for it, the body starts breaking down fat and muscle for energy. This leads to sudden weight loss, even if our appetite increases. For some people, this weight loss can be dramatic, 10 to 20 pounds in just a few months, without exercise or dieting. Now, some might think this is a good thing, but in this case, it's actually a warning sign, because the body is in a catabolic state, breaking itself down instead of building up. If we notice unexpected weight loss, especially if it comes with fatigue, increased appetite, or urination, it's very important to get a blood sugar test as soon as possible. Remember, diabetes doesn't always start with pain or clear symptoms. Sometimes, subtle signs like these are the body's only cry for help. Number 4. Blurred vision. One of the most often overlooked signs of early diabetes is blurry vision. Why does this happen? When blood sugar levels rise, extra sugar enters the fluid in the eyes. This causes the lens inside the eye to swell and change shape, making it harder to focus. As a result, we may notice difficulty reading, seeing clearly at a distance, or frequent changes in vision. Some people even think they suddenly need new eyeglasses, when in reality, their blood sugar may be the real cause. The good news is that in the early stages, this vision problem is often temporary. If we get our blood sugar under control, the swelling goes down and vision improves. However, if left unchecked, long-term high blood sugar can damage the tiny blood vessels in the retina, leading to diabetic retinopathy, which may cause permanent vision loss. So if we suddenly find ourselves squinting, struggling to read, or having changing vision, especially if we're also experiencing other symptoms, it's time to get our blood sugar checked. Number 5. Tingling or numbness in hands or feet. Another early sign of diabetes is a tingling, numb, or burning sensation, especially in the hands, feet, or legs. This is called diabetic neuropathy, and it happens when high blood sugar starts damaging the nerves, particularly the small nerves farthest from the heart. At first, this may feel like a mild pins and needles sensation, or just a slight numbness that comes and goes. But over time, it can turn into chronic pain, numbness, or even loss of sensation in the feet. The scary part? Some people only discover they have diabetes after developing a foot wound or infection that doesn't heal, because they didn't feel it happening due to the nerve damage. That's why it's so important to pay attention to any unusual sensations in the hands or feet, especially if they're new or persistent. If we catch it early, nerve damage can still be slowed or even reversed with proper blood sugar control and lifestyle changes. If you found this video helpful so far, please take a second to like, share, and subscribe. It helps others discover this kind of simple, science-based health education, and helps us keep making videos just like this. And if you or someone in your family has experienced any of these symptoms, tell us in the comments. You may help others feel less alone and encourage them to get checked early. Let's continue. Number 6. Slow healing of wounds. Have you ever noticed that minor cuts or bruises seem to take much longer to heal than usual? This could be a warning sign of diabetes. When blood sugar is high, it can slow down the body's natural healing process. This happens for a few reasons. High glucose affects circulation, damages blood vessels, and weakens the immune system, making it harder for the body to repair itself. This is why people with undiagnosed or poorly managed diabetes often get frequent skin infections, slow-healing sores, especially on the legs and feet. and even more serious complications if left untreated. For seniors, this is especially dangerous because it increases the risk of foot ulcers and other complications that could lead to more serious health issues. So if we find that small wounds take weeks to heal, or we keep getting infections, especially in the same areas, it may be time to talk to a doctor about screening for diabetes. Number 7. Frequent infections. Another early sign of diabetes is getting infections more often than usual. High blood sugar weakens the immune system, making it harder for the body to fight off bacteria and viruses. People with early or undiagnosed diabetes may notice recurring infections, such as urinary tract infections, skin infections, or even yeast infections in women. Infections may also take longer to clear, or they may keep coming back despite medication. This is because excess glucose creates a favorable environment for bacteria and fungi to grow, especially in warm, moist areas of the body. So if we notice we're getting sick more often, or if simple infections linger longer than normal, it might be a signal that something deeper is going on, like uncontrolled blood sugar. Number 8. Increased hunger, even after eating. Have you ever felt hungry again just an hour after eating? This may be a sign of a condition called polyphagia, or excessive hunger, another early warning sign of diabetes. Even though the body has plenty of glucose in the blood, the cells can't absorb it properly due to a lack of insulin or insulin resistance. As a result, the cells starve for energy, and the brain tells the body to keep eating, even if we've already had a full meal. The result? Constant snacking, larger meals, and cravings for carbs or sugar, all while blood sugar continues to rise. So if we notice that our appetite seems out of control, or we never feel truly satisfied after eating, it's worth investigating with a doctor. Unusual hunger, especially alongside frequent urination and thirst, can be an important clue. Number 9. Dry mouth and itchy skin. Dry mouth may seem minor, but it's often one of the first clues the body gives when blood sugar is too high. When blood sugar levels rise, the body tries to flush out excess glucose through the urine. But in doing so, it also pulls out fluids from tissues, leading to dehydration, dry mouth, and even dry, itchy skin. This may be most noticeable at night or first thing in the morning, or we may feel the need to constantly drink water or use lip balm. At the same time, itchy skin, especially on the legs, arms, or feet, can also result from poor circulation and dryness, both of which are affected by uncontrolled diabetes. If we're constantly reaching for lotion or feeling unusually thirsty, these subtle signs might be our body's early way of warning us. Number 10. Mood swings and irritability. Diabetes doesn't just affect the body, it also affects the brain and emotions. When blood sugar fluctuates too much, either too high or too low, it can lead to irritability, brain fog, tiredness, and even mood swings. Many people with undiagnosed diabetes report feeling easily frustrated, down, or anxious without understanding why. In fact, depression and diabetes often go hand in hand. Each one can worsen the other. The brain runs on glucose just like the rest of the body, so when sugar levels are unstable, mental performance suffers and emotional balance gets thrown off. If we notice we're becoming more moody or unusually short-tempered, it might not just be stress. It could be our body's way of saying something is wrong. The bonus symptom: sugar cravings. Believe it or not, intense cravings for sweets can also signal unstable blood sugar levels. When sugar spikes and crashes throughout the day, it can affect both energy and mood. We may feel irritable, shaky, or anxious until we eat again, especially something sweet. These blood sugar roller coasters are often seen years before diabetes is diagnosed. We don't always need complicated tests or scary symptoms to know something's wrong. Sometimes it's the small everyday changes, frequent thirst, a little more tiredness, or even just feeling different, that signal our body is asking for help. The good news? Diabetes can be managed and even prevented, especially when caught early. So if you recognize any of these signs, don't wait. Talk to your doctor. A simple blood test could make all the difference. If you found this video helpful, please like, share, and subscribe to Science-Based Health Facts. We post real, trustworthy tips to help you live a healthier, longer life, without the myths or the hype. And don't forget, all clinical studies and medical sources we used are listed in the description. Until next time, stay curious, stay smart, and most of all, stay healthy.